So, just a real brief reminder in case you ever need anything for Scrabble. We're looking at African swine fever, and it's the Asfaviridae family. This is a swine-specific virus, so this is one that will not affect humans, and that's something that we try to keep in mind because that'll come into play later on as we look at some of the control measures. Very, very hardy virus, can withstand a lot of pH range in the environment, resistant to disinfectants, but it can be killed by high heat, and I'll go over why that's important as well. So really, how is it transmitted? Mostly people think of the ornithodoros tick, another Scrabble word, which is the big, ugly, soft ticks. However, in a lot of these instances, you can get infection by infected meat scraps, and that's a very, very common method of transmission. But this can also come in infected equipment. So if you're processing animals that have been sick or handling infected meat and you don't properly disinfect those equipment, guess what you're going to do? You're going to transmit the virus. I bring up feral pigs because those are another very efficient mechanism for transmitting African swine fever. They are nice carriers on the hoof, can travel up to 400 kilometers depending on what mood hits them. And right now, love is in the air, so are the pigs. So really, we know the African warthog is the one that is not affected, but your Russian boars, your Asian boars, domestic pigs, they all can be carriers and can be infected with this virus. So what does it do to the pig, and why does this even matter? Well, when I was at Plum Island a couple years ago, really we saw pigs that were high fever, depressed, and that was really about it. We really didn't see a lot of external factors or indications, but what was interesting on the boards, as we noted, these pigs after infection had an extremely high temperature, 105 to 106 degrees Fahrenheit, consistently up to 5 days before those animals were euthanized. I bring that up only because if you do ever take the temperature of a depressed pig and it's that high, you kind of got to be a little bit worried. I do have rapid death after infection. This is key for the high virulent strain. There are other lower virulent strains that do not have the death associated with this, or acute death, which those pigs bring other complications as far as going into a carrier state. However, for this talk, what we were seeing, or at least the information we were receiving, was more referring to a highly virulent strain that basically decimated pig populations once they were infected. The other thing I wanted to bring up, if you do have pigs infected, they can look like a lot of other things. PRRS, PCVs, salmonella, circovirus, anything that can cause a systemic disease or systemic depression of the pig can look like African swine fever. So it can be deceiving, and that's why I'm bringing this up for the U.S. population, because we have a long list of differentials of things this could be. So how do you control it? Well, speedy diagnosis and euthanasia really is about the only mechanism. Because there is no available vaccine for this, there's no way to stop the viremia and shed. So a lot of times it's the slash and burn theory. Basically, remove the animals, disinfect the premises, have downtime and aggressive biosecurity. But like I said, there is no vaccine that is widely available that can hit all of the strains of African swine fever that are out there. And that is extremely problematic. There are some developments that are looking at homologous vaccines, modified live, being effective, but that is on a case-by-case basis, and I'll cover that in a little bit. So why the heck did we choose to go to Russia? Well, one, they had it, and two, we could. Really, our trip was interesting because we really wanted to get on farms, but at the time that we requested this, and we started requesting early in September of last year, and there was a lot of hesitance and reticence about even having us in the country. So we changed tactics and said, hey, look, we really do want to come over and learn what's going on, how are you guys handling it, what are your challenges, and what do you think we should do as the U.S. to help protect ourselves and to be able to help manage this disease, God forbid, if it ever should get here. So these are some of the things that we were thinking. Yep, ASF's a foreign animal disease. We never have seen it in the United States, and traditionally it's been kind of overlooked, and some of our funding even at Plum Island has really reflected that. Funding has been cut back. It wasn't really considered as a disease of high risk or high opportunity, not like foot and mouth disease anyway. But really, as we've gone on, we've seen it encroach into Russia and other areas, and it became more and more of a concern that, hey, are we prepared in the United States to be able to detect, diagnose, and deal with this disease? So we thought really it was a good time to be able to see what was happening in Russia and learn from their experience. The Russian Federation has seen a dramatic outbreak since 2008, and a lot of that was assumed to come from the Georgia Republic and even from Africa. So they are seeing this spread throughout the country since '08, and incidence has been on the rise. It's been dramatic, and it's just been really, really scary for that country and how they're able, or in some instances, in a lot of instances, not able to deal with it. So that's why we wanted to go and learn from them what was going on. So we had a merry band of people attended. I had Dick Hesse from Kansas State, who is the director of virology, Gene Erickson from North Carolina, who is now retired, but he had worked on ASF in the past, Dan Rock from University of Illinois, who also was involved in Plum Island and African swine fever research. And then there was Bill White, who was the acting director of Plum Island at the time, Kurt Rossow, a diagnostician at University of Minnesota, and then Liz Wagstrom at MPPC, and then myself. I got to take the picture. This was in front of the Kremlin. We were thinking we'd try to go in, but they might not let us out, so we never did get in there, but we tried. So where did we go? We went to several different places. We started with the Russian National Swine Breeders. They are a producer advocate organization. However, it's not like what you would think of National Pork Board or NPPC on the legislative side. These guys really focus on anybody that's got 2,500 head of pigs or higher. They don't really cater to the small peasant farmers, and I'll tell you why that's an interest in a minute. But they were very interesting to talk to, and a lot of times they act as a liaison between their member producers and the government. There's a lot of mistrust within the government between producers and the government. I mean, even more so than you would suspect. So those guys try to act as go-betweens on indemnity programs, disease control programs, and even messaging. So they were really interesting to visit with. The next group we went to is the National Center for Virology and Microbiology in Pokrov. Those guys are really where the rubber hits the road. They're doing most of the ASF diagnostics, test kit development, even the vaccine development. A lot of these places are really interesting because they were built, 40s and 50s in the Soviet era. And this particular facility was really neat because they had a lot of young researchers really excited about doing the work that they're doing, wanting to learn, wanting to share, wanting to collaborate, but have absolutely no funding to do anything. So they're always constantly lobbying for funds, lobbying for support. So it was kind of interesting to hear their perspective. But they are the folks that are really doing a lot of the ASF work right now, and they have over a 300 isolate repository in their institute of African swine fever that they've collected over the years, so it's a tremendous resource that we hope to be able to tap into. And then the last group we saw was Araya. It basically in Vladimir, Russia. This is the OIE FMD Center for Russia, so they are very focused on foot and mouth, but they also do support services for African swine fever as well as other aquatic diseases, bovine, etc. So we visited with all of their researchers and staff there. So why is Russia having a hard time? Well, a lot of it comes down to how their production system's broken out. If you look at our system off of the NOM survey or even other economic surveys, majority of our production is large organizations, or what we would call larger consolidated corporate entities. When you look at Russia, their agricultural enterprises in the blue basically would comprise what we think of as more of a commercial or an integrated type entity of modern production. The other almost 47% is what they consider as the private households, and then that last 7 or 8% is peasant farmers. And what that means is essentially people have pigs in the backyard. So you're looking at over half of Russia's production right now is basically set in a pastoral or a backyard farm setting. And this presents an extreme challenge to control measures, because if you look at a lot of people out in the countryside, pigs are utilized as basically a garbage removal source. A lot of folks will throw their scraps out. They may have a fenced-in village of 20, 30 houses and families. The pigs roam within those villages. They throw their scraps out. That's what feeds the pig. They harvest them. Done. We feed the village. So it's very, very hard to be able to do control measures on something that is very hard to control and it's not consolidated. So that does present a very big challenge. If you look at the per capita consumption in Russia, it is going up. A lot more people do like to have pork and they want to have that available. So that's another driver. And the reason this is also an issue comes up in the next slide. I'll tell you about that. But Russia really is trying to get more and more self-sufficient. When we were there, they had listed a mandate of trying to get 85% self-sufficiency by 2020. And the reason this is important is because that that mandate or that goal helps to drive how these guys are now handling their control measures. And like I said, I'll give you a hint about that in a minute, but it really is interesting on how their political policy is kind of moving and putting pressure on some of these smaller operations for disease control. Again, we just said majority of production is small peasant stakeholders. Really, commercial production's only started within the last several years. I even visited with some folks at a Genesis breedstock company that have just put in some modern production units, about 3,000 to 5,000 sow units, and we were talking about some of the challenges that they face there, and even some of the biosecurity things, which just blow your mind. You know, you have all these fencing and guards and everything else, but you look at the interior of the barns, half their panels on the hog level is wood. Okay, this is modern. I don't know where you guys went, but it is really, really interesting. So the biosecurity, though, is a very big concern. So here's some of the mandates. You can see in the meat and dairy side, Russia really wants to get to self-sufficiency. So as part of that movement, they're really looking hard at implementing some things that basically get rid of small farms and peasant farms. It doesn't really help in their ASF control now, except when they find farms positive, basically we might indemnify you if you weren't the cause of your own problem. If they determine that a farmer basically disrupted biosecurity and caused the outbreak, they don't get anything. So that's a deterrent. But also, if they do find a farm on these peasant stakeholder farms, if they are positive, we've heard of several instances where they've literally burnt the farm to the ground, dig a big hole, put everything in it, covered it back up with earth, that's it, you're done. They aren't renewing permits, per se, on some of these smaller operations, and in fact, at one of the last ag shows they had at the tail end of last year, they were highlighting basically production on everything other than pigs, rabbits, goats, sheep, chicken, but no pork production. So it was really very interesting. They're trying to focus more on these larger scale operations. So long term, you can see their trends have bottomed out basically since the mid-90s, and now are starting a little bit of a gradual upswing. The total numbers probably will not change, but the percentage of where that production is occurring will. So hopefully we can shift, or their interest is to shift that out of the 50% peasant farms to more into the consolidated ag enterprises. So this is where your arable land is, and this is interesting because it shows you where a lot of the ASF activity is, but really there's not a whole heck of a lot of arable land if you think of some of the bigger area in Russia, and that presents a challenge because a lot of their swine production is consolidated into areas where there's also ASF. So you can see in the top producing areas, let's see, I knew that was going to happen. There's Krasnodar, which is down in this region. That's where a lot of the pork production activity is, and that's also unfortunately where a lot of the ASF activity is. So it really is difficult because there's high concentration of animals and high concentration of pathogen. So this is recently, I just pulled this off of the OIE website, so it was as of February of 2012, and it shows the breaks from January 1 of 2010 to February. So you can see basically a lot of this started down in the Caucasus, and it's kind of migrated along this area into Russia, with the most recently being up in here in Karelia, again, right on the border of Finland, and it's got those guys really scared to death. Now, the interesting thing is, if you overlay this outbreak area with the map of the roadway system, you'll find it mirrors it exactly. And this is because a lot of the infections are caused by people movement. Because whether it's carrying scraps, carrying products, carrying pigs, people don't want the government to come in and say, your farm's infected, and they wipe out all their production or their herd. Even if it is only 1, 2, or 4 sows, basically, if that food supply is gone, that's the peasants' or the farmers' meat supply potentially for that year. So a lot of people are very unwilling to say, yep, our pigs are infected, let's have the veterinary community come out and test them. So now we see if people even find sick pigs, they'll euthanize them, sacrifice the pig, basically part out the parts, and carry that out to either family, friends within their own system, and the virus is moving that way. Feral pigs also play a tremendous role in this, though, because they do, can have a kind of continuous source of naive animals. Even though you may have a population of wild boars that come in, eat scraps either of harvested carcasses or sick pigs, that particular group of feral pigs gets sick, they die. then the population starts to rise again. Those pigs come into the same area, exposes to this virus that's very hardy, and the cycle just starts again. So it's just a very, very difficult situation. This is a possible spread. Obviously, we've seen this happen, at least towards the north, towards Finland. However, we've not seen anything proper into the European Union. Ukraine has set up some new regulations and restrictions and been working with Russia on biosecurity measures because obviously they're really scared to death that it's going to come in. I read a report recently, I can't remember, I think it was either through PubMed, but it was showing that Ukraine over the next year was 60% likely to get or contract ASF. So they have a high vested interest in maintaining security at the border. One thing I will bring up, though, and it's something that sometimes people overlook, with a lot of the activity that goes on with some of the military activity and some of the unrest and NATO movements that happen in the Caucasus, there is some concern with African swine fever traveling with troops, because NATO has regulations that say that people can bring their own native food and products with them when they go to foreign countries. So essentially, if folks get infected products or have, a sausage link or whatever that's infected with ASF, they carry it with them to another country that doesn't have it and discards that scraps somewhere else, and another pig eats it. Voila, you have infection. So that's another mechanism that people are really trying to look at and control and say, okay, we don't want to be the cause of spread, but we're kind of worried about other people that are there. So yeah, you can see some of these, the size of France is where that. So now what we have, like I said, reported as of February, way north, if you remember on the map, in Russia near Finland was the Republic of Karelia, and that was reported on 2/27. There's been several outbreaks associated with that one, and this is interesting because it was linked to feeding of waste of contaminated hospital and kindergartner waste to village pigs. So I keep thinking, okay, how does a hospital or kindergarten food project have ASF contaminated process that got fed? Well, again, if people are bringing in products that they aren't declaring as infected, you can have this go spread around. And it was interesting to note when we were in Russia, they still have, not in the major cities, but out in the country, a lot of it is like a flea market. You'll have people selling products, canned meats, fruits, vegetables, whatever, at the side of the road. And that's a lot of big commerce for folks as they're driving through a lot of these smaller republics and in the countryside. So it could be foreseeable that somebody picked up something contaminated and it got spread around that way. Again, wild boars come into play. One thing I thought Russia was doing that was interesting is they're working with hunters and basically putting a bounty on pigs shot. Some of those guys are really scared to harvest pigs because they think, well, this virus can go to people. We don't even want to touch it. And that's where communication and education is so critical, because African swine fever is not a human health or food safety concern, but that message is not getting out there. The veterinary authorities want it to try to do the right thing, but they're getting pushback because people just don't know about the virus. So what's the impact? Well, right now, as I looked it up, it's about 3 billion rubles, which is about 110 million US dollars. They're seeing a decrease in the number of large farms, even compared to 2010. I think a lot of people that have been infected are saying, the heck with it, we're done. There's also been just an overall decrease of pigs by 35%, and this is some of the last stats that I've seen. So, again, this is kind of in contrast to where Russia wants to be, but to where they are right now. And then the Jose Krasnodar canceled licenses of many producers. That's the Russian Veterinary Authority. So there's a lot of these small producers. They're basically saying, if you go out, you're done. We're not reissuing any licenses. So it's a little bit of a frustrating time for them. For us, well, we really did learn a lot. I think what it says for us is that we need to continue to strengthen our research on African swine fever, to look at how can we make sure our diagnostic tests can cover the various strains and be able to identify them rapidly and quickly. Also looking at the potential of penside testing. Is that something that can be done out in the field in case of an outbreak situation? So we are working on those things. Again, focusing really on our on-farm biosecurity. That ties in even now in the U.S. because we still have a lot of gaps. There's still, we look at PRRS. PRRS is a great way. We think we have our biosecurity shored up and we still get PRRS. So there's a lot of things I think in both small and large farms we really can learn from. And then another one is just looking at, continue the testing on these high-risk animals and high-risk operations like swill feeders. Because of the Russian experience, that's where a lot of their outbreaks are calling is coming from is through swill feeding. So that was something that seemed to reinforce that notion for us as well. So again, it just has increased the awareness of this disease for us. We've been looking at focusing on funding, and we just had our foreign animal disease call last month. So we are trying to look again, how do we develop oral fluid testings versus just the tissue or blood testings to be able to get ahead of the disease. We did fund some work looking at the genetic characterization of isolates and seeing are there communal genes that go along these different genetic lines, and then how does that genetic comparison match up then with our diagnostic testing? Can we identify these different strains? And then obviously potential vaccine development will come after we can do some genetic characterization. Until then, it's just such a big daunting affair because these viruses is just not lend themselves well to vaccine. And then we hope we've done some increased collaboration with Russian researchers. We hope that will continue. I do know there was a more formal USDA visit towards the end of last year, and I think there were some good talks and discussion with Russian researchers and the institutes that we visited. So we hope that we'll see some increased work together in the future.